My name is Conor Maguire. I'm a consultant geriatrician in Edinburgh. Prior to that, I had trained in Bristol and in Dublin. I attended one of the first masterclasses about 12 or 13 years ago, and subsequently went on to become a mentor for the Academy. I found the initial masterclass extremely useful because I was setting up a service for people with Parkinson's in Edinburgh. At that stage, a number of neurologists and a number of geriatricians within Edinburgh and the Lothians saw patients with Parkinson's, and there was no truly coordinated service. So following on from the advice I gained in the masterclass and the mentorship I gained from those involved in the masterclass, I set up a service advisory group within Edinburgh and the Lothians, worked synergistically and developed a service alongside my neurology and geriatrician colleagues. And the group meets, the service advisory group in Edinburgh now meets regularly, and it's a true multidisciplinary group with input from Parkinson's UK and the Scotland branches of Parkinson's UK. I've also more recently become involved in the Excellence Network linked to Parkinson's UK. Where I found the Academy very useful and the masterclass very useful was in having the peer support and the senior support available. So when I was setting up a service, when I was trying to develop new parts of the service, when I was meeting brick walls, trying to develop the service and trying to get more Parkinson's nurse specialists, for example, expand that service within Lothian about 8 or 10 years ago. I did not know how to go about it, and I made contact with some of those who had been my mentors when I had attended the masterclass, and they gave me extremely useful advice on how to approach developing the service, how to approach those within management within the NHS in Lothian in Edinburgh. And as a result of that, we were able to further develop the service very successfully. One of the areas I'm covering at the masterclass presently is the early treatment of Parkinson's, what to start, what agents to use, when to start them. And this is a difficult field, and one of the most interesting things I noticed is when I did my slides, I had one slide showing Edward Monk's The Scream, and I looked through the masterclass book and noted that one of my other colleagues, Dr. Lindahl, also has the same painting within her slides, indicating some of the frustration or some of the angst that we feel when deciding what treatment to give and what to do next in people with Parkinson's. What I hope to cover, or what I do cover within this talk, is the evidence behind the various treatments available, the treatment modalities available for Parkinson's, starting with pre-motor or neuroprotective potential treatments. Is there evidence there for them? And if there is, what should we start? And then at what stage to start patients on any specific medications. I also cover the evidence behind, based on randomized controlled trials and meta-analysis, behind different forms of treatment, from levodopa to monoamine oxidase, B inhibitors, dopamine agonists, etc. And I illustrate this by going through a few cases at the beginning of the talk, and then repeating the cases at the end, asking those attending whether they have any ideas about what treatment they would use. And these cases are actually real cases that I have come across, the most interesting of one of which I reviewed in my clinic yesterday.